As your delivery time approaches, your body will release prostaglandins, which cause softening and ripening of cervix. The mucus plug may get discharged on the day of labor or few days before labor. Discharge of mucus plug shows that your cervix has started to efface. Effacement is a process where cervix stretches and become thin. As your cervix is effacing, dilation also begins and your body starts getting ready for childbirth. There are 3 stages of labor. First stage begins with true labor. During labor, the uterine muscles begin to harden and tighten. This results in contractions. Contractions begin on the top of the uterus and moves toward the bottom in wave-like motion. This forces the baby to move downwards towards the cervical opening. As the baby's head pushed on the cervical opening, the cervix begins to efface and dilate. Once the cervix is completely dilated up to 10 centimeters, the baby can pass out of the uterus through the cervix. As you progress into labor, your amniotic sac may rupture. If the amniotic sac does not break, then your doctor may perform amniotomy, artificial rupturing of the amniotic sac using amnio hook. Once the amniotic sac is ruptured, the delivery should be completed with 24 hours to reduce chances of infection. The second stage of childbirth begins when the cervix is fully dilated. Your doctor will now advise you to push your baby. You should gather all your strength and concentrate on pushing. Follow breathing exercise and find your own best position to push. You may experience burning and stretching sensation as your baby moves down the birth canal. It may take few minutes to few hours before your baby's head finally comes out. This is called crowning. If your baby's head is too big and unable to pass through the vagina, then the doctor may make a small cut between your vagina and the anus. This is called episiotomy. As his head is delivered, facing downwards, his head turns to the side and aligns with the shoulders. With next few pushes, the shoulders are delivered and the rest of the body slides out with ease. The baby's head may look like a cone. This is normal. It will dissipate in few days. 2 clamps are placed on the umbilical cord and the cord is cut and detached. In the last stage of delivery, the placenta will detach from the uterine wall and is expelled through the vagina. This completes your labor and delivery.